Welcome back to Journey to Joy Live. I am Dr. Joy. We're here to talk about International Overdose Awareness Day, and I have my guest, Dr. Ashaki Warren. So tell me about yourself. Tell me about your company. Tell everybody what you just started.
So I'm Dr. Warren, and I first want to shout out Dr. Nina Mena, who I met at UC doing the psychiatry, and all her enthusiasm for the work in the field of mental health. I am also a child, adolescent, and adult psychiatrist. I have a private practice called Love Your Brain Psychiatry, which is founded on the principle of first starting off with self-love and just radical acceptance of who you are and what apparent flaws you may have or not, before we go into the process of considering medications to help improve functioning quality of life. The first step is accepting self and love.
I just love your motto and your mission. Every time I look at your videos on Instagram, I just feel like, oh my God, I just love my brain. I love myself. Just everything you present. So where can we find you?
LYBP on Instagram.
Yes. All right. So although we are smiling here and having fun already, we do have more of a grim topic today, but it's okay because the purpose of Journey to Joy Live is to discuss how can we get towards joy, but also to provide awareness to everyone and break down the stigma. And I think in and of itself, substance abuse, dependency, addiction, whatever you want to call it, in and of itself probably has one of the biggest types of stigma, right? When you're addicted to something, you can't kick it. Family is looking at you a certain way. They give up on you, and it makes you feel some kind of way to even talk about what's going on. So it's good for us to talk about this and why it's important. So let me just talk about like what International Overdose Awareness Day, what's the purpose? So just real quick, the purpose is to remember loved ones who have died from drug overdose and acknowledge the grief of the family and friends left behind. Also, to take action to encourage support and recovery for everyone impacted by substance use and overdose. Lastly, is to end overdose by spreading awareness and overdose prevention strategies. So we'll get into a little bit of that. So what is addiction, overdose, substance use, however you want to say, what does that mean to you, Dr. Warren?
So I think addiction is in multifold. So there can be like a physical addiction where your body and brain is used to the substance. It's not so much that you get a therapeutic effect and then when you stop it, you lose the therapeutic effect. When there's a physical addiction, there's actually some physical withdrawal that happens afterwards, like your body and brain gets a little bit worse and has some new symptoms just because the brain has to adjust to not having that symptoms. Sometimes it can be kind of dangerous to abruptly withdraw if your brain gets used to a certain signal. So that's a physiological form of addiction. Then you have the emotional form of addiction where psychologically there is something that you're getting from the substance that tends to be different from its intended purpose. If we're talking about a prescription medication, we've heard of the opioid epidemic and Percocets. In theory, they're prescribed for short-term pain, but there might be an extra, like a boost in emotions or not thinking about things that people start liking a little bit. And there becomes an emotional addiction, a pattern of not feeling like they can function, or they start wanting the substance for reasons to get enjoyment other than their intended purpose. And also when you start getting emotional addiction, you don't really enjoy things as much without it. Like it actually matters. You start thinking about it, you crave it, you're distracted by it.
Yeah, I mean, it really breaks down our normal reward system and changes our brain chemistry. So like things like food that's like super satisfying, sex that's satisfying, some favorite thing, or the runner's high that's usually supposed to be satisfying, those things aren't satisfying anymore because your brain is so used to that opioid or the cocaine or whatever you're addicted to. So you need that high. Sex isn't going to do it for you anymore.
Or you start needing more and more sex. Or you get kinkier, because the regular sex doesn't get you the same dopamine effect. But also, it's not just that. So with you can get an addiction to sex in that you start having unhealthy things that you normally wouldn't want to, but you don't feel like you can stop it too easy. It becomes problematic in your life, or you start doing things outside of your normal personality because you got to feed that addiction. You start changing a little bit.
Yeah, yeah. And addiction, some people have the dual diagnosis, so mental disorders along with the addiction. And it could be depression, anxiety, bipolar. It could be that mental disorder led to the addiction, or the addiction kind of brought out whatever mental disorder was already manifesting because of genetics. It could be a lot of variations of how this addiction comes about. But let me jump into some stats real quick. So did you know, Dr. Warren, that opioids account for 2/3 of drug overdose deaths? 69% are because of opioids.
That's real. That really is.
Yeah.
And within that 2/3, I would be curious because the opioids are not quite as life-threatening and dangerous when it comes to the abrupt withdrawal. But where they are dangerous is just the intoxication of opioids, because they uniquely will shut down the system, but it feels good. And the person doesn't realize they're shutting down their respiratory drive, their heart rate drive, their drive for their brain and their heart and their lungs to keep breathing. So it is surprising, though.
Yeah. And you're right. Because initially I was thinking, you can die from withdrawal, but I believe that is true. With the opioid withdrawal, you can't die from, but it's alcohol withdrawal you can die from.
Yep. You get the seizures, potentially coma. Yeah. I mean, you can, not as many deaths, surprisingly, from alcohol intoxication.
Right. Not from intoxication.
People pass out and get sedated first. I mean, you can definitely get alcohol poisoning, but it's not as many acute alcohol deaths. They usually pass out or something else stops them from drinking first. But what happens with the opioids, too much of it too quickly, it's not just a nap.
Exactly. And so actually from the year 2010 to 2020, the opioids globally doubled as far as the number of people dying, from 26 to 36 million to 61 million people in 2020 being addicted to opioids. So that's a lot of people. So it's definitely an epidemic. And in the United States, in and of itself, there's about 100,000 overdose deaths in the United States. And that's increased about 15% from 2020 into 2021. So anyway, I just want to throw out numbers there. I'm not one to be throwing out numbers, but when it comes to this, I think it's safe to say that, it is an epidemic, that's for sure. So let's see. We have some reference sheets here that we can talk about exactly, some risk factors of how do I know I'm addicted? I don't even have to use a reference sheets for that. How would someone know they're addicted to something or that they're dependent? Dr. Warren.
So signs of addiction, you start altering your patterns or your behaviors to modify in order to start to do the substance instead of your regular work or recreational activities. Attempts to stop are unsuccessful, or you kind of, what more commonly people say, they tell themselves, well, I don't really need to stop. Sometimes people don't realize they have a problem stopping because they think, it's just I don't actually think I need to stop anymore. But if at some point you thought you should have stopped or cut back, and then you change your mind and you decide, I think I'm gonna do it anyway, that's a sign of addiction. Also using more and more, needing more and more of the substance to get the same level of high. That's another sign of addiction. What else we got?
Exactly. And so as far as like how people get into the addiction, like I mentioned earlier, sometimes it starts with a mental illness, sometimes it starts with a drug, but majority of people become addicted, not the route that you expect. There's usually that story of someone who got an injury, let's say a back injury, right? They're in so much pain, chronic pain, daily pain, and their doctor gives them an opioid, oxycodone, hydrocodone, Percocet, whatever. And so they're like, this medication works for my pain. I don't need to take anything else. This is great. For whatever reason, well, I shouldn't say for whatever reason, it increases tolerance in general. So taking that medication increases that tolerance. And so therefore they need to go higher dose of that medication and even higher and even higher and even higher. Sometimes the docs either they decide not to give them, continue to give the medication, or they change doctors for whatever reason. And something happens where they're not able to get that medication anymore. What happens? They turn to heroin to try to get that chronic pain fixed. So it really doesn't start with, like the usual junkie on the street. It could be anybody that could just fall into this. And it's so sad because when they get into the addiction, whether it's the pain pills or somehow that slippery slope into heroin, they're addicted and it's difficult to stop. What do you think about that?
And part of it too is it may start off with a physical pain, but usually when it comes to addiction, at some point, there's something else that opioid brings the individual in their mood, in their emotional state, that it's hard to be without.
Yeah,
Separate
it
from
feels
just
good.
the pain. Really, it does feel good. And not only does it feel good to have it, like when your brain has adjusted to having it, you feel awful without it. You don't even
It's like
feel
you
normal.
need
So
it.
sometimes it's like just to feel normal and not in despair, I have to keep that opioid going from anywhere I can get it. And you mentioned the heroin, but when people do the street options for looking for prescription Percocet, unfortunately, a lot of times the quantity, the actual concentration isn't regulated. So you think, oh, I'm still getting Percocet. It's not regulated. So you don't know the exact concentration. And it's not like they're not necessarily giving you too much of the actual prescription Percocet with a little bit dangerous. You may not get as much as that. You might end up with some fentanyl, which
That's
tends to
what's
be even
good.
more potent, but
Yep.
more addictive. So think about this. These are not,
It's
the
almost always laced with
distributors.
something else. Like
Yeah.
my husband says all the time, drugs aren't like from the 70s where it's clean and natural. But right now it's like laced with things. Even marijuana can be laced with fentanyl.
Yeah.
Xanax, Xanny bars, whatever people want to call it, that could be laced with fentanyl. You're trying to ease your anxiety, all of a sudden you overdose on fentanyl. It's
Yeah.
strong. You don't know what you're getting into.
And street drug dealers, they're not necessarily trying to make people overdose. It's just a tricky thing. They want customer bases that is alive, actually. They don't want people to overdose. They want you alive. They want you to be able to find money and keep getting their products. They
So then
just
why
don't
they
know
giving
what
you
they're doing
fentanyl? Why they giving you
because
fentanyl?
fentanyl is so addictive. It's more
Oh,
addictive
dang.
than the regular marijuana, and it feels so good, and it's more addictive, and it's real potent.
They
So in
want you
their
back.
mind, they're thinking, I'm getting an instant customer basis who's not going to be able to want to go anywhere else but to me. But they just don't know what they're doing, and there's no accountability.
Gotcha.
That's that they're not accountable for the quality and the content, and they actually don't necessarily know what they're doing. They're motivated solely by the ability to have a profit.
Oh my
Really
goodness. That's
can't
so true.
You can't trust the unregulated street drugs. Even marijuana, I don't necessarily agree with it for psychiatric uses, but it's a difference between growing marijuana from the ground that you know what's in it than trusting
Natural.
a friend who's a drug dealer that didn't grow it themselves either.
What you trying to
Somebody
say? Our patients should grow their marijuana. I'm kidding.
I'm just saying. I'm not saying they should grow it, but just know I don't trust the people who are producing it to be accountable to make sure they're not just trying to give you something potent and keep you really addicted to their product. You can't really
Exactly.
trust anybody who can't be accountable and regulated and held accountable under law for what's in there.
And to be honest, I don't think you can overdose from marijuana. So when I see patients and they're smoking marijuana, they hitting the Xannies, the opioids, and drinking and cocaine. And when they kick like at least 3 of those and they're still also smoking, I'm like, you know what? It's okay. You're still smoking marijuana. As long as you kick them harder ones where they can kill you. We can talk about the marijuana
we
later.
talking about a lot. We talking about some real stuff.
I know.
We are definitely talking about a lot of stuff, Dr. Enjoy, because I do encourage my clients to try to obtain full sobriety, or at least if they're going to use the marijuana, there's not an addiction where it becomes a daily use. It affects quality of life and functioning and impairment over time. Not in the short term, but if we can just keep it so it's not like you're
Yeah.
needing it and then you're having this high use. However, if I had to choose, I've seen the differences between
Yeah.
opioid and marijuana, way more functional.
Well, see,
There
that's the
may be
thing.
a decline, although I also have had a client who over a year of kind of daily marijuana use, trying to be off of the opioids, they end up getting real paranoid and delusional towards their spouse who they otherwise really
Well,
loved. And
while
they
on
weren't even,
marijuana,
pardon?
while
Oh,
on marijuana. Yeah, yeah, exactly.
yeah,
Marijuana can make
marijuana.
you
So like
psychotic. Some
it
people
gets
can't do
tricky. They're not
marijuana.
going to die, but the
But
first world
no,
psychosis is real over time. Not,
yeah, for sure. And
yeah,
maybe that's marijuana laced with something, maybe it's not, but depending on
who
your gene,
knows?
marijuana can make you psychotic. But no, I agree with you. I'd rather people have the full sobriety, but I pick my
Yeah.
battle. So I'm
Oh,
happy for
yeah.
you if you done kick that more serious habit.
Yeah. I mean, and that individual did have genuine chronic pain. And that was a difficult situation
Oh
for
yeah,
them
medical
to figure
marijuana.
out, because they were fine, with stopping the marijuana, but then it's like this pain and figuring out alternative options, you know.
Exactly. And I know you mentioned you didn't watch Painkiller, right? You didn't see that on Netflix. I don't know if I'm plugging that or if I should be plugging it, but it's obviously something I need to talk about or at least bring up because they definitely dig into the opioid pandemic or epidemic, whatever you want to call it. And it just, people want to make money. So they make a drug that is going to make money. And that's pretty much what that documentary was about. And
Hmm.
it's very interesting.
And
I'd
we
say
are
it's
in a more patient-centered medicine. So while a doctor say, I don't want to keep prescribing it, if you like it, you demand it, you want it, like, why aren't you giving it to me?
wow. I know it's safe to say I don't get paid by what medication I give. So for me, I'm not like I mean, I know you're not either, Dr. Moore, but we're not like paying pill poppers, just giving a medication just
Hmm.
because, I believe in therapeutic techniques and things like that because we don't want them getting dependent on it. And
But
even
it's
the
hard to look
benzodiazepine.
somebody in the eye. It's not even just about money. It's hard to look somebody in the eye who's in despair, in desperation. They're not
Wow.
addicted, and they happen to be the bad guy to say, "Oh, it's going to be bad for a minute, but we got to get you off, or we can't continue." So it's like the idea: what feels nice now, long term, and
Yeah,
somebody's
so
got to
long term.
be. So it does bring up the point of why introduce things that give these highs if they
In the
can't be
first
long
place.
term sustainable.
Yeah, because to me, I feel like, especially like the benzodiazepines, so Xanax
Mhm.
for anxiety, it's basically like a band-aid. Like I'm not treating your underlying anxiety by just giving you Xanax. You're feeling good for the meantime, and then when it wears out, your anxiety comes back and you need it
Yeah.
again. So that intensive
Yeah.
therapy is what you really need,
Right. I mean,
or a long-term medication like a
yeah, they're
Prozac or something.
SSRIs, though, if they're designed for long term maintenance treatment of anxiety. If it's only designed for short term, it's hard to separate a person who's in intense anxiety almost every other day. This feels good now, but trust me, you can't keep using it.
Yeah.
It becomes a hard situation because what feels good now,
And I
it's
think
hard
it's the
to.
education that we need to give. We call it
Mhm.
psychoeducation. So if we're going to put patients on the medication, if the primary care doctor or pain doc is
Mm,
going to put them on these meds, we have to enlighten them ahead of time. This could happen. You can have tolerance, you can have withdrawal, you can have dependency, you can have trouble getting off of it. So watch yourself, count your medications, make sure you know that you just took one. And
mhm.
this we're getting into the risk factors for overdose now because as you become tolerant, maybe you're just like, oh, I'll just take another one. Oh, I'll just take another one. Oh, and you don't realize how much you took.
Yeah. And if the medicine gives you any extra boosts or enjoyment other than its intended therapeutic purpose, that puts you a little bit more vulnerable.
And
Let's
you
say
know what?
if we can get real, let's say for example,
Lord.
lovely Adderall, right?
Mm-hmm.
You so Adderall, it has neurocognitive benefits, executive function, attention, and concentration. That's its primary therapeutic
But if it
use in
makes you feel
ADHD.
good, you shouldn't be on it. You're
Yes,
not on
and
it to
I'll be
make you
like,
feel
telling
good.
people, like, it might give you a little bit of a upper or buzz or make you feel like you can conquer it or ignore that. Don't try to get that again. That's not what we're looking for. think of it as a side effect and not the intended therapeutic benefit.
Oh,
Because
a
if you keep
side
chasing that
effect.
boost, that's where you start leading to addiction. That's going to go away. That's going to fade.
Yes, that's
You can't look for
right.
that. Oh, I need a higher dose because it doesn't work as well as before. That might be just that initial boost. That's a side effect of the medicine. It's really a more subtle neurocognitive
Yeah.
improvements
And
that is
for
not
people,
I can accomplish the world.
right, exactly. You really shouldn't have that because that's sounding almost like mania. But for people who watched my ADHD segment
Mhm.
last week, they already know that I said I have ADHD and that I used to be on Vyvanse. And I didn't get any of those, like, ooh, I didn't get any. It made me focus on things. I didn't get that. But a medication where I felt that, the epidural that I had, my last baby, because my first baby, they put morphine. This past baby, they gave me fentanyl. And I was scared. I was like, wait, what are you
Oh,
giving me
wow.
fentanyl? And to be honest, it didn't 100% take away the pain, but I felt good.
Interesting. Right,
I
right.
felt good. I mean, I wanted more because I needed it for the pain, but it's
It
obviously the
just felt
top.
a little dangerous. Like I shouldn't feel that good.
I was like, oh. So anyway, that's why you got to be careful. And I know people who they get the prescriptions of the opioids when they have like a dental procedure or whatever kind of procedure, invasive surgery, and they're just like, I'm not going to take that. I'm not going to start that because they know what's in their genes. Like if you have addiction runs in your family or an addictive personality, I know when I like something, I love it. So,
Mhm.
I know not to do certain stuff. Yeah.
Mhm.
But so getting into overdose. So like if you are with somebody who's using those opioids, perks, hydrocodone, whatever, and so let's talk about the signs of overdose. How do you know they overdose? Well, for one, they're not breathing anymore, or their breathing is slowed, or they look like they're sleeping and they're not responsive. So shallow breathing can be woken up, gray fingertips, blue fingertips, you want to call 911 for sure. But,
Mhm.
well, let's see. I guess I can get into the whole Narcan thing because we're going to talk about Narcan. But before
If
we get to that, go ahead.
I do want to mention one other another vulnerable group for actual overdose, not just addiction, because we've been spending quite a bit of time with addiction and tolerance and how it starts building. So, truthfully, someone who's been gradually increasing their amount of opioid over years is probably
Yeah.
less risk for overdose death than someone whose body is used to a smaller amount and they do that same dose as someone who's been gradually increasing, their body's used to a smaller amount. They're like, oh, I want a better high. And they go too high too quickly. And then that's when the brain and respiratory functions, those shut down. And the other vulnerable group are people who were used to having a level of tolerance. They were used to getting up to a certain dose in order to get that high. And they have a wonderful victory of achieving sobriety. I said they might even have a year, 5 years, but guess what? Their body resets and they don't realize that their tolerance is much, much
Yep.
lower. So that can be unfortunately another vulnerable group. They
So
do
they say, so they
heroin.
end up, to finish that sentence, they end up taking that same dose that they used to
Mhm.
take a year ago, but since their body's not used to it, they overdose. They
Yeah.
die. Yeah.
That's what kills. That can be what kills them.
That's a
Even if
risk
they
factor
think,
for
oh, I'm
sure.
only going to take a medium, an in between dose, it's still way too much for what their body is used to. So that can be another vulnerable area is when people go back to what the dose is. They don't even think they're overdosing. They don't realize it, but it just can be dangerous.
Exactly. Yeah. And one thing's for certain. So in ending overdose and preventing the death of it,
Mhm.
let's say you're there with your buddy and they overdose and you're like, oh my God, they're unresponsive. But I'm not
What
calling the
do I
police.
do?
I don't want to
Doctor's
get in
choice.
trouble. I got
Yeah.
heroin here. I got my perks here. I'm not gonna get in trouble. There
Mhm.
is a law, Georgia medical amnesty law. I think I'm saying it right, where it protects you if you call 911 in your possession of the paraphernalia, the drug paraphernalia. The cops will not charge you for drug possession. So that's that law that protects that,
Mhm.
so that your buddy can survive. Because if you're over there and they pass out, they're about to die, you can feel comfort that let me save their life, let me call 911, let me get the
Mhm.
medical help because the cops aren't going to arrest me because I have drug paraphernalia on me. So that's real important. And that's the Georgia law.
New.
I imagine other states have that too.
But that's a new thing.
It's new. Wow. Do you know
if
how
you didn't hear about it before, that's because there wasn't always that clear law.
Oh
but
God.
now, because there's been so many cases where people are using drugs and they just try to save the person themselves and do cold water. You see the movie, they put them in the shower. It's happened so many times. They had to explicitly make it clear. You don't have to guess. This is okay to do.
Yeah, that's right. And speaking of what you just said, because they're talking about here, and I was looking at the what is it? The International Overdose Awareness, the Pennington Institute Initiative. They have a lot of different fact sheets here and campaign kits and everything. So basically, what not to do if you suspect they overdose. Don't leave them alone, and don't give them anything to eat or drink, and don't try to induce vomiting. So that's as far as if you're concerned about an opioid overdose. What else I wanted to say is what to do, right? Because you said call 911. We have the Narcan. Oh my goodness, I have a Narcan kit. Let's see, is it backwards? Let's see. I don't know, it looks backwards. Anyhow, so Narcan is naloxone. Oh wait, I just realized it's dark. I didn't realize that before because I was covering my face this whole time. Do I look dark?
No, the background is dark, but you got some good lighting.
Okay, so sorry. Narcan is naloxone. So an opioid is pretty much an agonist that attaches to the receptors and makes you feel real good. But naloxone, also called Narcan, is an antagonist, which blocks the opioid from being able to do its thing. And it has a higher affinity, as the doctors call it, but it has a better liking or loving for that receptor. And therefore, the opioid, whatever they overdosed on, is not able to attach to those receptors. So it kicks it off. So that is a good thing when you're about to overdose and almost die. And you give that while they are experiencing that overdose. So you make sure they're down on their back. And you can get this on Amazon, get it on Narcan.com. Okay.
So this is not just for doctors, nurses, EMT. I'll be honest, I'm a doctor and it's a little intimidating to me. It is. I think we should pretend. I don't think if we pretend that the average person should just be okay with injecting this, because it's a little bit daunting. But the evidence is saying, think of all the prescriptions and the barriers they make. They're saying the risk benefit trade-off of your friend or someone you know really about to die versus you just putting that in there and just following the basic instructions is so effective at saving people's life.
And it's not as intimidating as you think. Like, it's not an so an EpiPen is something that you have to like inject in them. The Narcan is actually a spray that you spray into their nose.
Okay. Oh.
Yeah. And so you can spray it once, you can spray it twice, you can spray it 3 times, 4 times. You cannot overdose on Narcan.
Nope.
So if you think they overdosed on opioids, you can use Narcan. Even if it's also cocaine, it's not going to affect it if it wasn't opioids. But if you just, for the slightest thing, if you think it was an opioid, you can use Narcan. I say that to say that the Narcan doesn't save you from cocaine overdose or stimulant overdose. What are the others? Or benzodiazepine, the Xanax overdose. It doesn't save you from those things. But if you think they also use an opioid, and that's the thing that's making them almost die, then yes, use the Narcan.
Worst case scenario, only time you get negative effects from the Narcan is if the person actually has been using opioids. You just put them into withdrawal. So they may feel achy, runny nose, uncomfortable, but guess what? They are very much alive in those opioid substances that are telling their brain, don't worry about breathing, you don't need to. All of that's kicked off. They may get uncomfortable withdrawal, but they are alive to have it.
Exactly. Yeah, so I think that's the most important kicker today, as far as the International Overdose Awareness, is to be aware that Narcan, naloxone exists. You can have it in your house. You can buy it. You can get it for free at certain places. Chris 180 is going to now have it available for anybody who needs it, if you happen to be on site. So Yes, you can get in. You can have in your possession certain healthcare, mental health fair. That's where I got this one. Remember, we got this at the mental health fair. Where yours
Yeah,
at?
yeah, that was me. I got mine.
You don't know where it's at, but you got it.
It's in the car. It's in the car.
Oh, I think that's a good place. So that'd be a good thing to understand if you can, how to store it and things like that. But
Mhm.
yes, it's easy to spray in the nose, better than the EpiPen.
Yes.
All right. So let's see what else. I think so. I talked about everything I wanted to mention. That's for sure. I think. What else do we want to talk about today? Breaking
Well,
down
if
the stigma.
we talked about overdose, and you kind of painted a picture to dispel the myth of that it's not just someone that's on the street or homeless who might be at risk for addiction or overdose. A lot of times it's people who don't even have an emotional or psychological addiction, but their body's so used to using it for medical reasons that if they start using more than they're supposed to,
Mhm.
it can be dangerous for them.
Exactly.
Other things, so some of the common celebrities, entertainers,
Oh my
just
gosh.
kind
It's
of
in
bring
the
it home.
news. It's in
Highly
the
successful
media.
people who have sometimes they have a whole life ahead of them. They're not even thinking about it, but
Yeah.
they're just, the addiction makes them ignore the risk because we know they're aware that there's some risk. This is addictive and this could be dangerous, but the psychological addiction and the pain need it makes them ignore that risk and take it anyway, and taking more than they're supposed to.
Exactly. That's
Yeah.
true. Yeah.
So
And I
Michael
mean,
Jackson, beloved, rest in peace.
yeah,
Prince.
propofol.
Yeah.
Mm-hmm. Yeah. Whitney Houston, her daughter.
Yeah.
We were talking about Marilyn Monroe and Elvis. You said Prince first, I think.
Yeah.
Yeah. So as we remember these wonderful icons,
Who to
you
us seem like
it's
they're at their
preventable.
peak. Yeah.
This is preventable.
Yes.
Yes. So that's, if anything, that's what we're gonna say. It's preventable. You can get Narcan, you can have it on you. And I mean, Narcan's important because what did we just say? 2/3 of overdoses because of opioids.
That's
So
true.
yeah, but get treatment. If you feel like you need help, or if you don't even know if you need help, talk to someone, therapist, psychiatrist, primary care, anybody. Just get the help. We're here. And for people who have been through it, they go through Narcotics Anonymous, Alcoholics Anonymous. They have sponsors that continue to help them through this. So those are support groups for that. So talk about it, share it, what you've been through, and that helps somebody else get through what they've been
Yeah.
through.
And
We
the
just
person
been
that,
talking. I think we reached, did we
yeah,
reach? Yeah, we definitely over 30 minutes.
I know we might have to do this again shorter.
I know, right? Oh my goodness. All right. Well, thank you so much, Dr. Warren. So we can find you at LYB Psychiatry. That's your
LYO. Yes. So on Instagram, hashtag LYBP. Love your brain psychiatry.
nice. Thank you for joining me. I think people know by now how to find me. I'm gonna tag you, Dr. Warren. Thank you for joining me. I'm gonna have you come again. Obviously, I'm gonna definitely have you come back. So I appreciate everyone. See you again. So September is recovery. So actually, this day goes into recovery month, and it's also suicide prevention awareness month. I'm gonna spend most of the time on that topic. Probably, entering a little bit of the recovery, but I'll be seeing you all on that, and see you next Thursday. Thank you.
Thanks for having me.